Hello and welcome. I'm Dr. Adam Dorsey, a psychologist in Silicon Valley, and I am the host of Super Psyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. Super Psyched is your tool to get more of what you want in your life and less of what you don't. When you hear the word hypnosis, what do you imagine? Perhaps you imagine a well-dressed doctor with a heavy Viennese accent with a pocket watch swinging back and forth. Perhaps you imagine a person on stage entertaining an audience. But what really is hypnosis? And how can it help us lead healthier and more fulfilling lives? These questions and more will be answered by my guest, Dr. Jeffrey Zeig, who is one of the world's top authorities on hypnosis. Jeff has trained people in clinical hypnosis in over 40 countries. He has practiced hypnosis for thousands of hours over the past 40 years, and he has authored multiple books on the topic. In addition, Jeff was the direct protege of Dr. Milton Erickson, who, in my estimation, was the most important person in the advancement of hypnosis. Jeff is the founder and the director of the Milton Erickson Foundation, as well as the architect of one of the most well-attended international conferences of psychotherapy called The Evolution of Psychotherapy. He also works as a psychologist in Phoenix, Arizona. We will address questions like, what can hypnosis do for me? Who should I see if I want to receive hypnotherapy? And what criteria are important in selecting a professional? It is my pleasure to bring Jeff to you as we have a lively and user-friendly conversation about hypnosis. Dr. Jeffrey Zeig, who has asked me to call him Jeff, welcome to Super Psyched.
Thank you, Adam.
So I'm very taken with hypnosis, and I'm sure that when you meet people for the first time and tell people that you are a hypnotherapist, a teacher of hypnosis in 40 countries, no less, people are probably intrigued. People probably have differing ideas of what that actually means. I was wondering if in layperson terms, you could actually state what is hypnosis?
Well, hypnosis could be considered a state of focused attention where the person is focused on what is immediately relevant. And in that state, you have better access to psychological, physiological potentials. That's a capsule lay definition of hypnosis. To me, hypnosis is a form of influence communication, a form of evocative communication that helps people to get conceptual realization of where it is that they are targeting, where it is that they need to go.
And if you were to even break it down as simpler language so that perhaps even my 11-year-old son could understand, how would you say it?
Well, it was at a movie. In this movie, we were on a train, and the villain has a priceless letter from Rembrandt, I think Rembrandt, and it's priceless, but it is a clue that will solve the crime. And he starts to burn the letter. And some young man in the front of the audience stands up and yells out, "Don't do it." It was a movie.
Yeah. That's by the movie that he
imaginative
it felt real.
Exactly.
So hypnosis is much like that.
Like an imaginative involvement, like the reverie that you could be in when you were in a daydream and you were so fascinated with what it was that was going on in your mind that your external circumstances didn't matter so much.
You've referred to it as the mother of all therapies and the mother of all experiential therapies. And I think that's a great way of describing it. How is it the mother of therapy or of all therapies?
Therapy started pretty much in 1885. It's a relatively new profession. And it started when Freud became interested in the psychological aspects of medicine. But there wasn't anything to study about the psychological aspects of medicine, so Freud went to Paris and studied with Charcot and was so fascinated with Charcot, who was teaching hypnosis, that he adopted it and brought it back to Austria so that he could use hypnosis to practice. So it was the first tool that was available to people who were interested in matters of the mind. And it was used in the infancy of psychotherapy as psychotherapy was beginning. But then Freud rejected hypnosis, and that set hypnosis back quite a long time because he thought that it sullied the pure gold of his psychoanalytic method which was based on understanding. If you probably asked Freud if he was in the people-changing business, he would have said no. He was in helping people to understand. And hypnosis is not being an archaeologist where you're searching for buried treasure that existed from the past, but hypnosis is like being a tour guide, helping people to get from point A to point B as quickly as possible. Now, when I was defining hypnosis for you, I was defining it in common terms as an intrapsychic event.
Yes.
Really, hypnosis is a relational event and should be thought of as a special kind of human relationship. And that's how I teach hypnosis to advanced psychotherapy students.
How is it a relationship?
Well, it's a relationship in which one person is responding to the meaning that's projected by another person. It's an intense search for personal meaning. And if we think about even a simple sentence like, we are talking, well, that's a simple sentence, but what is the interpersonal meaning of that? We're getting close, that we're sharing ideas, that I'm teaching something. So there's meaning in sentences. Now, when you have a science, like you're thinking about how to compute a mathematical equation, then you're stripping the communication of implied meaning. But most communication is based on interpersonal responsiveness to implied meaning, which could be gestures and tone and tempo and posture and proximity. And what we do with hypnosis is we build a way of helping people to respond to the implied meaning of communication, which is studied in social psychology, but hasn't really weaved its way into the centerpiece of current academic psychotherapy.
Wow, I think that's amazing. It seems almost like there is a Sherpa-like relationship between the two people, in that in the Himalayas, there are these tour guides, so to speak, who help people on their treks up mountains, who know the lay of the land fairly well. And it sounds like the person providing hypnotherapy is a bit like a Sherpa to the unconscious of the individual receiving it.
Well, it's like everybody has a resource, but they may not be in touch with it. Like you could have a professional speaker who is frightened about being in an airplane, and you could have a test pilot who's afraid of being a professional speaker. And these people have incredible resources in their area, but somehow they are divorced when it comes to the problem at hand. So hypnosis is thought of in popular culture as a way of putting people to sleep, but really it's a way of waking people up to their potentials.
What have been some of the biggest surprises in terms of resources that you've discovered along the journey?
Oh, I remember when I started, and this was in the mid-1970s, early 1970s, really, and I was watching a demonstration. This was at a professional meeting, and the hypnotist, who was a dentist and had almost a master's degree in psychotherapy, was hypnotizing a physician. And she suggested that the physician's arm would raise, but he wouldn't feel as if he were doing it. Now, as a graduate student, I never saw anything like that, and it was happening. And then she suggested that the man's hand would become anesthetically numb. He was a physician, and his hand became anesthetically numb. And then seamlessly, she inserted a surgical needle through a fold of skin, and he didn't wince. But then the thing that convinced me was that she said, "How many drops of blood do you want to bleed when I take out the needle?" And this was somebody who was recognizing that you could talk to the physiology and that physiology would respond. And as a graduate student being absorbed in the curriculum that I was learning, this was news to me. And I said, okay, I better study something about hypnosis because there's a technology out there that is more than what I was learning in graduate school.
Amazing. And for my listeners, many of whom are located in Silicon Valley, very smart, very successful oftentimes, how could hypnosis benefit them?
Well, if you think about it from a simple model, I know, I realize.
So you're actually touching two different parts of your head because they're not going to see this. So there's...
I see. So and when I say I know, I'm touching the left side of my head, and I realize I'm touching my chest and the right side of my head. There's a gap between knowledge and realization. I know to be kind. I know to exercise. I know to eat well. I know to not smoke. I know those things, but do you realize what you know? So I think about hypnosis as an amplifier that helps people to realize what they know. So it's
That's
like,
amazing. And have a felt sense of it, and they're like a visceral felt sense, so that
yeah,
they can
if you
hold
think
on to
about
it.
it, sorry to interrupt, but if you think about it like a parent talking to an adolescent, the parent wants the adolescent to be responsible. Now, if you explain to an adolescent why it's important to be responsible in life, you're getting nowhere because the child already has the idea and knows that responsibility exists. So there needs to be an experiential moment, which could be hypnosis, could be getting a job, could be falling in love, could be having a pet, could be joining a sports team. And suddenly the child realizes, I can be responsible. Now, it takes an experiential moment to transport somebody from a moment of knowledge to a moment of realization. And we hope that that realization builds itself into an identity. I'm a responsible person. But trying to give somebody an algorithmic formula for being motivated, responsible, connected, intelligent, using their intelligence, being creative, these things cannot be taught by an algorithm, a series of logical steps. There needs to be an experiential moment, and hypnosis provides an experiential realization for people when they can activate what they know, and it can become a conceptual realization.
The reason I was laughing is it's as if you were watched in my home. I have a 15-year-old and an 11-year-old son. And that's right.
You know the problem.
I know the problem. And there's often a chasm between what we know and what we do, a chasm between common sense and what people actually do as well. I'm really taken with that idea. And I'm also blown away by it firsthand. I've received hypnotherapy and I've found it extremely useful. I'm wondering, what are some of the applications that hypnosis is known to assist people with?
Hypnosis has been used in the literature, scientific literature, in every aspect of medicine and psychotherapy. You could use hypnosis in gastroenterology. There's a protocol for IBS, irritable bowel syndrome. It's a problem that vexes people who are gastroenterologists, but there is a protocol that's well researched and can be used that will help people with IBS. It's been used for surgery. It's been used for childbirth. It's been used in psychiatry for moderate problems, and even in severely disturbed patients, it's been used successfully to help people. So there's a very large literature about all of the different areas in which hypnosis has been used. But a proviso, I say to people, don't shop for a technique. And in California, where people are hypnotists, especially, they're not psychotherapists, they're not licensed practitioners in a medically related field, and they don't have the ethical and legal protections that are available if you're seeing somebody who's a professional. And still, don't shop for a technique. You shop for the right person to talk to. Each practitioner has their own way of approaching things. If the problem is post-traumatic stress disorder, yes, if I used hypnosis, that would be my tool, but there would be other tools that people would have at their disposal. So find the right person and don't shop for a technique.
Can you say a little bit more about what that actually means to the consumer in terms of shopping for the right person? What should they look for?
You're looking for somebody who's understanding, who's empathic, who immediately grasps the essence of your situation, somebody who you feel that you can talk to and bear part of your soul that you may have not felt comfortable bearing to somebody else. You know, most problems can be solved by individuals, but there's some situations where you need a trained listener, you need an experienced person to provide a little bit of guidance that will help you when you're a little out of adjustment with yourself and you need somebody from outside the system to be able to help.
And how important is licensure? Should the
Yes, I wouldn't take my car to an unlicensed mechanic, and I certainly wouldn't take my life, my psyche, my psychosocial well-being to somebody who didn't have a license. And there's lots of people, coaches, and that are not licensed. So, like, if I did something that was out of conformation with my profession as an Arizona psychologist, you would have recourse, and you'd be able to find me culpable. If I
Exactly.
breached confidentiality, if I, did something that was out of conformation with the ethics and standards of my profession. So it's important, I think, for people to have something to rely on, because in every field, there's lots of unscrupulous practitioners, lots of people who don't really know what it is that they're doing and have some religious belief in a particular technique and are slavish to that technique. If you were seeing the hypnotist would know before you came in that they were going to use this technique. And I don't know what technique I'm going to use with any given person who comes in. Yes, I'm known for doing hypnosis, but I have a lot of other tools of the trade that I've developed over decades of practice.
So just a bit of a pivot. That's, first of all, great information. I'm also aware that one of the indications is warts, that actually hypnosis can relieve a person of their warts. I don't get it. How does that work?
I don't get it either. I attended a lecture from a senior immunologist, and knowing that hypnosis affects warts, he said that if somebody could figure out the pathway by which that happens, it would earn Nobel Prize. We don't know the pathway, we just know that it works, and that the dermatological conditions can respond to suggestion, powerful suggestion, and perhaps given within a hypnotic context, but also through other means. We don't know the capacity of our mind to influence our body.
Incredible. I delight in that one. That one just strikes me as just such an interesting artifact in the literature. It also seems to be very much indicated for smoking cessation, and my favorite, improving one's sleep. Are those consistent with your findings?
Sure. So hypnosis has been well researched as a tool for smoking cessation. And there are protocols, like very standardized procedures that people can use. But if you came to me and you wanted to stop smoking, I might invent a procedure in which hypnosis could be a part of it, but might not be the center part. It's that the person knows that smoking is not good for their health. And so in a moment, you decide to be a smoker. There's a defining moment. You think it's cool, it's sophisticated, it's grown up. And when that thought becomes a conceptual realization, you practice for a couple of weeks and you're a smoker. Well, to stop smoking, there needs to be another realization. I don't have to be a slave to this habit. And then over a series of time, the urge to smoke, the thought of smoking drops out, and you become, in your reality, a new identity, a non-smoker.
I love the idea of reinvention. I know that you've cited your mentor, Dr. Milton Erickson, whose memory is a blessing and whose work you really carry forward as such a devoted protege. It's actually very touching to me, and I'm grateful to you because his message needs to be heard more than ever in the field of psychotherapy. I noticed there's some resonance between his message about reinventing the therapy as well as Irv Yalom, who also says the therapy is reinvented every time somebody walks in the room. Is that consistent with your approach to hypnotherapy as well?
It's consistent with my approach because it would be inventing a new induction for every patient and not just using a standard script, a standard protocol, because the induction is a context in which we can activate, and it's a way of reaching people. You don't have to say hello to a friend in the same way every time. And you certainly don't have to, engage in an intimate conversation in the same way every time. So part of the joy of being a therapist, which you understand, is reinventing yourself and not just slavishly doing something over and over again in the same way, which is necessary for research, but not necessary when you're actually holding a person's heart and history in your hands for a moment, and they've lended it to you so that you can help them to improve their adaptive ability to negotiate their life.
I take such delight in that, and it strikes me as so humanistic in such a kind of spectacularly contra to the idea of manualized therapy, that one-size-fits-all approach. I love that you do that, and I think about Dan Siegel's notion, interpersonal neurobiology, of feeling felt through attunement, the idea of do you feel me, man? And you kind of more than hinted at that when looking for a therapist. You should feel felt by that individual. And one of the ways that you ensure that the person feels felt is you get to know them before you invent the induction.
Yes. Yeah. And, induction is like you want somebody to laugh. You hope that you can help them to feel good humor. Well, you can't just say to a person, feel good humor. You may tell a joke and they may respond or they don't respond to the joke. It may reach them or it may not reach them. But there's an artistry in telling a joke and making a simple bit of humor come alive. So like the induction can lead to trance, a joke is a way of providing an induction that could lead to humor.
I mean, I imagine that misconceptions about hypnotherapy are all over the place. What are some of the most common misconceptions? And could you please disabuse us of those?
Sure. There's two major misconceptions about hypnosis. Number one is control, and number two is control.
All right, let's hear.
So people believe that they'll have remarkably enhanced control and that they'll remember everything that they've read, that they'll be able to go back in time and achieve a past life or remember their childhood vividly. And people believe that they'll lose control, that the hypnotist will make them do something that is out of character or is embarrassing to them, or that they will have surgery under the hypnosis and they'll be amnesic and the hypnotist will suddenly rearrange their psyche and they'll be better after that. So those are common myths, and they're perpetrated in the popular press and also in media. We think of this Svengali-like figure who is controlling poor Trilby, and so it's myths that continue to this day. And part of the problem is to demythologize hypnosis as a way of realizing more of your personal power.
I love that. And I love the idea of tapping into these resources. I remember in dreams, I used to find new rooms in my house. And I, looking at that symbolically, kind of think of that as a metaphor for resources that I hadn't known existed. And I think that, to your point, we are all walking around with these untapped resources. What are the most common untapped resources that people might be able to tap into through a good therapeutic relationship with a good hypnotherapist?
There's certain ways that we disempower ourselves. Can't, always, never, what if he, she, they would just. So the can't, right? I can't stop smoking, or I can't be kind, or I can't be motivated, or I can't stop procrastinating. And in that sense, in a loose sense, we negatively hypnotize ourselves and would limit our possibilities. I'm writing a biography right now of Dr. Erickson, and it's something I was working on just before we started talking, and it's collecting a series of informative stories about Dr. Erickson. And I was editing one last night. He was teaching medical school, and he comes into the classroom of aspiring doctors, and he says to them, "I'm sorry, I didn't tell you this. We're going to have a test in 5 minutes. And this test is going to determine your fitness to be in medical school. If you fail this test, you are out. Now you have 5 minutes to take a break. You come back and we'll have this test." And when the students came back, Erickson, and this is in 1940s, 1950s, said, "Well, how many of you were in the diuretic group and how many of you were in the peristaltic group?" In other words, some of the students got scared.
Exactly.
Right? And he wanted to demonstrate to these medical students how the mind affects the body. And this is before we had the concept of a mind-body connection, that we don't realize some of the resources that we have available to ourselves, and especially in terms of our motivation and using our capacities to make the world just a little bit better place.
I'm thinking about John Sarno, the NYU medical professor who wrote a book called Back Pain No More, in which you would actually talk to your back. He was a physiatrist, if I recall correctly, not a psychiatrist, a physiatrist who was able to help people, particularly during their earning years in their 40s, get out of excruciating back pain just through the act of talking. And as you convey this story from Milton Erickson, who was so good at creating experiences for people, the father of all experiential approaches to therapy. I mean, he really gave his med students an experience. So they had to be unforgettable and unequivocal. It's like, okay, I felt this. That's real. You've conveyed stories about him taking people outside, looking at the directions that trees bend. I take great delight in that. I wonder if you could share a little bit about your relationship with Dr. Erickson, as well as if there were some things that people could know today that would be most helpful from his teachings.
Yeah. Well, normally in medicine, you have an algorithmic approach. If the person has broken their bone, then you have a series of steps that you take. You have a decision tree. You follow the decision tree, and probably you get a good result. In an interpersonal situation, the experience that you have is a teacher. We learn experientially. Like right now, I'm learning Spanish, which I've been doing for quite some time, and I'm not learning experientially because I have to learn the subjunctive case and all of the ways that the verb changes in the different forms of the subjunctive case in Spanish. Now, that is painful for me. There has to be a moment in which that becomes automatic. And the automaticity of everyday life is like learning like a child. You have an experience, you learn how to speak the subjunctive case if you grow up speaking Spanish. So Milton Erickson was an experiential teacher. He was a conceptual communicator. But then when you think about it, so was Picasso, and so was Shakespeare, and so was Steven Spielberg. These are people who communicate by giving you an experience. If you want to know about love, yes, you could study that the nucleus accumbens septi in the brain lights up when you're in love and put somebody in a functional MRI and learn what areas of the brain light up when you're in love. But if you really want to feel love, read a novel, read Shakespeare, read poetry, and you experience love. So Erickson's communication was baffling to a lot of people because he wasn't speaking scientifically, he was speaking experientially. And he did this through stories, through hypnosis, through symbolic activities, through games, through fragments of literature. And he was doing people building from the inside out. I thought he was going to teach me how I would do a hypnotic induction. I was Erickson's student intermittently between 1973 and then I moved to Phoenix in 1978, and then he died in 1980. So I spent a considerable amount of time with him, and he never instructed me in the traditional sense. He never said, this is how you do a hypnotic induction. I would learn through the experiences that I lived and not through my left hemisphere. So, if you want to know the horrors of war, somebody could explain that to you in an encyclopedic fashion. But if you looked at Picasso's painting Guernica, you will automatically get a felt sense of how horrible war can be. So we want people, there are certain things that can't be taught algorithmically. Motivation, responsibility, connection. Those are things that have to be realized. And so when the problem is that something needs to be realized, then using hypnotic methods or experiential methods derived from hypnosis, that's a good idea. If it's something that you can learn didactically and somebody can explain it to you, great, just do it didactically. But when people come to me, I don't think that they need information. I think they need an experience that enlivens their life. And so I've taught myself to be more of an experiential therapist than a didactic therapist. And hypnosis is a mainstay, but it's not even center stage all of the time in my practice.
I think about the ways of the East, including the way traditions are passed down. It's not didactic. It is experiential. I think of Yoda in the movie Star Wars, and he wasn't there standing behind a lectern. He said, go do it. And that sounds like that's part of your approach. You really engage the mirror neurons. You really engage a person's ability to feel it viscerally. I think it's brilliant. And it sounds like that was probably one of the best pieces of what you got from Dr. Erickson in your relationship. Anything else you want to add to that?
Well, it's just thinking about two different grammars, that there's a didactic grammar if you want to learn mathematics, and that there's an experiential grammar in the world of art. And what Erickson represented, even though he was a scientist and did experimental studies, is being the most interesting and complex communicator. Now, when you study about hypnosis, you learn how to use tone and tempo and the rhythms of speech silences and gestures and postures and proximity. And hypnosis teaches you how to use all of the output channels of communication to have the maximum effect that you can have on another human being. But then you don't have to rely on doing hypnosis to use some of those skill sets. You harness those skill sets when you want to have impact. When is it that you want to have emotional impact? When is it that you want to have conceptual impact? And at those moments, it's then that you use techniques that are experiential, that are related to hypnosis. And that should be true if I'm working with a patient, but it could also be true if you're talking to your adolescent child. You need to use a grammar that will help you to advance this situation and not rely on a didactic grammar or an experiential grammar all the time, but understand what is the outcome that you want to have and then use a grammar that's appropriate to getting that outcome. So really, I learn more by studying art, all of the arts, than I do by studying about my colleagues' approaches to psychotherapy, because my interest is in developing an experiential repertoire that will empower people, not a didactic repertoire that will educate people.
I imagine cinema has been very important in your evolution. You're
Absolutely.
nodding.
Yeah. And I don't even like it. It's so powerful and it's such a strong way of manipulating your emotions that I hesitate to go to a movie unless it's something that doesn't take itself seriously. But I study the intricacies of the grammar and the grammar of cinema, how you do lighting and costume design and music, and how you bring together these different arts that are subterranean to the person who is watching the movie. You know that there's been music in the movie and that's influenced you emotionally, but you may not remember any of the themes when you leave the movie. You don't pay attention to the cuts. In a James Bond movie, there may be one cut every 4.3 seconds, but you don't go out of the movie realizing that you've seen a stitched together piece, and you don't realize that the director is choosing to use a wipe or a fade or a different kind of a cut to have an emotional impact. Nor do you realize that a good editor might time the cuts of a movie when the editor wants you to blink, because a cut is a discontinuous movement, and when you make a discontinuous movement with your head, you tend to blink. So there's a technology that movie makers know that may be implicit to them, because I have interviewed directors and they didn't exactly know what they were doing until I said, well, you were doing this to get this effect. And they said, oh, yeah, because they had overlearned that in their repertoire. Like even something simple as more often than not, the socially superior character in a movie appears on the left side and the socially inferior person appears on the right side of the screen. So there's codes. And when I went to the film school in Krakow and I asked them in Poland, they knew immediately. The students knew immediately. But when I've talked to directors, they might not have known immediately what it was that they were doing, but intuitively, like tying their shoes, they knew to put the socially superior person on the left side and the socially inferior person on the right side. The senator would be on the right and the reporter would be on the left.
That's incredible. So to your point earlier about the Rembrandt letter, anyone who's been in a movie theater or seen a movie has been in a trance.
We think that we're the captain of our ship, but really we're in steerage and we don't know who the navigator and captain are, because so much of our behavior has to do with the automaticity of everyday life and the way that we automatically respond to context. If you want to feel awe, yes, you could try to imagine it in your mind, but if you stand at the rim of the Grand Canyon, the context promotes awe. If you want to feel faith, yes, you can do that by praying by yourself, but if you go to St. Peter's Basilica in Rome, you'll feel faith. So context is an influence that we don't necessarily pay attention to, but tone and tempo and the direction of speech. And these were things that Milton Erickson would explore. And he was an explorer of the possibilities in communication and how these effects could actually be realized. And in the field now, the academic field of social psychology, we have much more research that proves that some of the things that Erickson was doing actually do have a researchable effect.
Incredible. And to your point, my friend and colleague, Dr. Jonah Paquette, a psychologist who wrote a great book called Awestruck, in which he studied the science of awe and what happens to our brains when we are in a state of awe. It turns out a lot of great things happen. We become kinder, more community focused, and happier when we experience awe. So to your point about the Basilica in Rome or the Grand Canyon, these are awe-inducing experiences that can put us in a hypnotic state. I love that idea. Many people have exposure to hypnosis solely through, I believe it's called stage hypnosis, where somebody gets on stage, he's an entertainer, and he gets people to cluck like a chicken or bark like a dog, and then everybody laughs and goes home. Is that real?
Well, I've been to stage hypnosis presentations, and they're using a confederate. So a lot of time they pick somebody who is known to be a good actor, and they use that person repetitively. If you went to the show 2 nights in a row, you might see the same person being hypnotized. But in that situation where you're coming to that for entertainment and where you've given prestige to this hypnotist, you are behaving in accord with the contextual demands of the situation, and you want to be entertaining and you want to follow this script, but they're picking people out very quickly who will respond to them immediately. And if you don't respond to them immediately, they dismiss you from the stage. But this gives hypnosis, because I love the beauty of hypnosis, and it's offensive to me to see people using it for entertainment. But some of the principles that are being used could be applied in more constructive ways and more ethical ways.
I'm with you. Before we get to the last question, it appears that some people are more likely than others to enter a hypnotic state.
Yeah, there's a concept that you study in psychology, internal locus of control, external locus of control. So some people are very responsive to cues in the environment, and some people are more self-defined in their direction. So we're all responsive to cues in the environment. We can't not respond to cues, but there's degrees of responsiveness. Now, in academic psychology, when you're researching hypnosis, you have a standardized induction and 12 standardized tasks. And if you get all 12 right, you're highly suggestible. And if you get 0 of them right, you're not suggestible. But this is an artifact of the test construction and how hypnosis is viewed in the necessity of having a standardized procedure that can be researched in a laboratory. And then you can compare how do high hypnotic subjects react to creative situations compared to low hypnotic subjects. But this is an artifact of the way in which the test is composed. So it's easier for me to think that anybody who can be socialized can be hypnotized. If you can respond in a social situation to the contextual cues that are given, the communication cues that are given, then you can enjoy a hypnotic experience and use it to the maximum capabilities that you have.
That's incredible, because I am familiar with that test of suggestibility, and I'm really glad that you clarified that. So let's imagine just for a second, you have wizard-like abilities, and you could confer upon all beings the ability to derive benefits that are given from hypnosis to all members of the planet. How do you think, and obviously it would vary from individual to individual, but on average, how would individuals' lives be better? How would society at large be improved?
Well, normally we equate hypnosis with peace, and that you can be in a lenitive, relaxed state. And the wear and tear of all of the things that are happening, especially in this era where there's so many things that we're being bombarded with that disturb our equilibrium, our sense of equanimity. So if we could do something that would spread the sense of equanimity, that would help people to deal adequately with the anxiety of everyday life and the impending nature of death, that we all face, and we can do something that helps people to be more grounded and to live their lives in ways that are more meaningful, more personally meaningful. And I don't think that hypnosis is the panacea that's going to get us there. But in my fantasy, because you asked an excellent question, that would be what I would want for people, that we would live in a more harmonious way and that we would be better at building each other's sense of equanimity.
Beth, I can't thank you enough for sharing your wisdom. I can already tell I would love to have you on again. You embody just so much of what I care about. And I'm so glad that you're a luminary in my field. I'm proud to be connected to you.
Adam, you did a great interview. It was really a pleasure, and I enjoyed the time that we just spent together. Thank you so much. Thank you for what you're doing.
This is Dr. Adam Dorsey thanking you for listening to Super Psych. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe.